Much better. That's good. Okay. So relax your arm. Okay. So this is what I'm gonna go, right?
Yes.
So
Tickles?
Yeah,
Oh.
it's understandable. As I stated, you literally just need one. You barely will see any bleeding. And when it comes to wiping, you always wipe from the part that you are going to poke, then you gradually will spread it out. So it's small concentric circles, okay, inside out. And once you are out, you can't go back in because you would have contaminated the site. But if you finish and you think it's dirty, you just take a new one and do it. Okay. And of course, you don't tell the patient, oh, you are so dirty. Yeah. Just put it down and take another one. All right, so I take it and you don't have to pinch. Some people think they have to pinch to wipe. Don't do that. You know, sometimes it's good to hold it down. That way the patient has what? Flabby skin, it doesn't what, roll out. So you only hold a small area so that most of the gauze, not the gauze, the alcohol pad will do. Do not open the alcohol pad anymore, okay? If you are doing it and it opens up, that's fine. But you don't open it. So you go in small concentric circles so you can see it's opening up, which is fine. I haven't opened it, just keep going. Don't lift it. So now I am done. Exactly.
But you never open
Yes,
it.
you never open it. If it opens on its own, that's fine. But let's say I started going and I lifted up that, oh, and I go again. This is wrong. Okay? I have to do, or I start going, I do a perfect job, then when I get here, I come back to the center. No. Again, you don't also want to keep going over and over to the same area. That's not
So
for
you never overlap with what you've already done.
In other words, this is what I'm saying. You know, when I'm going, this is where I'm going. But I'll gradually will start and spread it out. So I go here, keep spreading it out.
Make the circle bigger. That's all you're doing.
Yeah, small concentric circles until it comes out, okay? From inside out. But what I'm saying is once you get out, you don't come back to the center.
Right, okay.
Neither do you start and, oh, when you lift it and you continue. That's also wrong, okay? But I have to do it again, okay? Because what I was doing was practice, showing you. All right, so I open this. Then I start wiping the side. It takes about 30 seconds to dry, okay? All right, so then I pick my gauze, put it in between my fingers, okay? Take my tip, then, not my tip, my syringe, and make sure it's tight. Take this off, okay? The bevel should face where? Up, and by up means it's facing where? Excellent, so it's facing me. And one of the clues is when you have this kind of safety, that safety is always going to be the side that will show you the bevel. Because when the safety faces you, the bevel is also facing you. But yes, it's always the direction of the bevel. Because think about it, if I go here, it's going to mess up my angle. Okay, so it always faces you. And you always hold it halfway down. If you realize I've not had anything with the app, so you should, under no circumstance, will put your fingers on top. Okay, halfway down. Then I pinch the patient's what? Fat. Okay. Make an anchor, and I'm going up. I'm not going down. I'm going where I have the tightest pinch because it's less painful. And I just go in. Okay. Don't tell the patient you won't feel anything. They have to feel something. But what you can say is it's going to be a small pinch and it'll be over before you know. But if you tell the patient you won't feel anything and they feel the pinch, they can what? Jump. Yeah. All right? And that'll be your fault. So you see that even though I'm explaining and talking to you, I have a nice ankle, so I'm not what? Shaking. You get it? So that anchoring is very important. Okay. And you can see the needle is all the way what? In. It's 45 at an angle, so it has to go all the way in. Okay. Then you would what? You don't have to check for blood because normally with fatty tissue, you won't see blood. So it's okay to just what? Gently push your medication in. Then now that the medication is in, I take my gauze, apply it up there, okay? Remove it, and here it's simultaneous. As I apply what pressure on the side, I activate the safety. But so you guys can see it, I'm going to do it here, okay? But you don't do it up, you do it away from you and the patient. But you activate the safety by pushing it up like that with your thumb until you hear the click. And when you do, you put it straight in the what? Sharps container. You will not always have a sharps close to you. Most places will have it on the walls. So if you have that case, you can tell the patient to hold it for you, then you go throw it away. Okay, don't expose the sites. Okay. Then afterwards, you do two-fold. You know, you do two-fold. One fold, and what? Two. You get it? Then now, you do one of two
That
things.
was the best part I've ever done. It's very good.
Awesome. You what? Tip it halfway and then stretch it to the other side and you turn it, okay? But I want to show you how you would do it with the if you have it like this too. I mean, personally, I like the other one, but there's nothing wrong with doing this. When you take it like that, you hold the edges, try not because the gauze is going to be stuck on it. So you hold the very edges, turn the patient's hand out, then you would what? Tip it. You are not gonna do two. I just wanted to show you. Okay. And afterwards, you ask how you feeling.
Good.
Okay. Since it's a shot, if it's a new shot the patient is getting, or a shot that most of your site don't know how responses are, you let the patient sit maybe in the reception area for about 5 to 10 minutes to make sure they don't get any reaction before you let them leave. Okay. So you thank the patient and you leave, or you direct them to the waiting room. Okay. And you are done. Now, to remove